Good afternoon. Thank you so much for joining us. My name is Susie Flug Silva, and I'm the Siegel Program Director at the Center for Youth and Communities at the Heller School at Brandeis. As most of you on the call know, the mission of the Eli J. and Phyllis N. Siegel Citizen Leadership Program is to foster the next generation of citizen leaders. And we're a constantly expanding intergenerational constellation of leaders working across sectors to solve society's most pressing issues. And this network includes 138 fellows, some of whom are on the call today, and we add new fellows every year, as well as over 500 founders and partners. And today we'll hear about the various ways that our fellows and our founders have been responding to the COVID pandemic. And as Phyllis and Susan were referencing, this is a pandemic that has cost the US over 500,000 lives, and over 2.5 million people have died worldwide. It's had so many other public health and economic consequences, and COVID-19 has impacted everyone, but it's impacted communities and individuals unequally, with a heavy burden and disparate impact falling on BIPOC communities, low-income communities, and other marginalized groups in the US. And we'll hear a little bit more from our panelists about that. Many of you guys are fellows, our founders, our loved ones. You've been impacted directly through illness or loss. Many of you are also on the front lines doing this work, and we're grateful to everybody everywhere who's doing that hard work to keep our country and our communities going, and people that are doing that across the world. Those in healthcare, education, first responders, mail and deliveries, food service and groceries, warehouses, sanitation, government, and so many other key fields. Our thoughts are with each of you, whether you're here with us live or whether you're watching this recording, as you navigate the impact that COVID is having on your own lives. But today we're here to talk about responses and taking action. And so for responses through healthcare, we'll hear from Segal Fellows Raquel Perez, who's a registered nurse, and Imani Islam. We'll also get to hear from Tom Freedman and Maria White about how Freedman Consulting is helping their clients respond to the crisis, and also helping people focus on underrepresented and vulnerable communities. And we'll hear from Janice Mendelsohn and Arnie and Kanter about how their philanthropic endeavor, Innovation 80, was designed not only to support underserved populations through the arts, but also to be a pandemic response. This is an extremely inspiring group, and it's only a small example of how the Segal Network has been responding to COVID. As we just heard from Phyllis Siegel, our program founder and one of our namesakes, she's been working with Encore to help them figure out possible plans for an intergenerational COVID vaccine corps, among other endeavors. So we want to keep this conversation going. We're grateful to all of our panelists for joining us today. We're grateful for all of you for joining us today. We'll hope to have at least 10 minutes, if not more, for discussion at the end. So with that, we'll have our panelists each briefly introduce themselves: Raquel, Imani, Tom, Maria, Janice, Arnie, and Carol. And then don't worry, they're not only getting a minute to talk to you, they've each been given more time to share about their work and experiences.
Hi, everyone. My name is Raquel Perez. I am a current neonatal ICU nurse, as well as a per diem COVID response nurse. I was a Service Year Alliance Segal Fellow for 2019, and I'm very happy to be, talking about my experiences. So thank you all.
Hi, I'm Imani Islam, 2019 Segal Fellow, recent Brandeis graduate of class 2020. I started working at Devoted Health and now have transferred over to City MD Urgent Care.
Hi, I'm Tom Freedman. We have a consulting firm that about 30 of us work on, including Maria White, who's done almost everything with us, including helping us think about new initiatives, which has been really important this year. And the notion is, how can we help public interested missions? Even sometimes that means we're working with philanthropies or with governments or collaborations or public-private partnerships. But the notion is, how can we use different tools to try and improve the world? And obviously, COVID has cut across so many of those, all of our topics, and been a mirror for a lot of societal problems.
Do you want to say a word about your Segal family and program connection?
My connection goes back to emotionally when I first met Eli and Phyllis, but Eli in particular, I saw someone who dealt with love and respect and excellence, and most of all, cooperation with the world and the power of that. And it deeply influenced me. And I'm happy to be a founder, but I helped set up the Welfare to Work partnership with Eli. And then when I was in the White House for President Clinton, I worked closely with Eli as well.
Thank you. Maria?
Hello, it's lovely to be with you all. My name is Maria White, and I'm the advisor for new initiatives at Freedman Consulting with Tom. And Tom and I talk a lot together about sort of what the implications of our potential new projects and our existing projects are for the current policy landscape and vice versa. And my background, like you, John, is a lot comes out of the labor movement. And I spent a lot of time there thinking about policy and politics and doing a lot of research, organizing, and advocacy. And it's been really exciting working with Freedman to kind of bring all of those thinking styles and interests and skill sets together to help philanthropy and policymakers and nonprofits think about how they're going to respond to these emerging threats and needs and how to serve communities best. So I'm excited to talk about that with you today.
Janice, we can go to you next.
Hi, I'm Janice Mendelsohn, not so recent a graduate of Brandeis. I graduated with Arnie in 1964, and after a long period of knowing him and knowing Carol, we did become friends, and he followed me to my neighborhood now in Chicago. I was a resident and an attending pediatrician at the University of Chicago for about 40 some odd years and have been retired now for 5 years. And so Arnie convinced me, number one, to help support the Segal Institute, which I gladly did. And then we decided among ourselves to begin a new adventure, and that we did a year ago. So you'll hear more about that later, but that's me now.
Thank you. Arnie, we'll go to you next, and then Carol.
Sorry about that. I'm Arnie Kanter, and as classmate of Janice's in the class of '64, I'll always remember Phyllis and Eli's anniversary date. It was June 13th, 1965, and I know that because Carol and I were at the wedding, and they spent their honeymoon driving from New York to St. Louis, where on June 20th, 1965, Carol and I were married. So we go back a ways with the Segals, and we count them among our very best friends. And it's been a pleasure to be involved in the Segal program, in part because it continues my contact with Phyllis on a more or less regular basis.
Thank you, Arnie. Carol?
I'm Carol Kanter, and you've heard from Janice that how we got together to start this Innovation 80 fund, and from Arnie about our connection with the Segals. I can just add that I'm a psychotherapist and I've been in practice forever. And I also write poetry and have great respect for artists and their work. So that's me.
Thank you so much. And they referenced it, but I just want to directly acknowledge that our founders on the call, Tom, Arnie, Carol, and also Janice, support the program in a number of ways with their time and energy, but also with their donations. So we're grateful for that as well. And with that, we will dive into the content, and we'll start by hearing from our Segal Fellows who are have been impacting COVID on the front lines through health. And Raquel, we'll start with you.
Hi, everyone. So like I mentioned before, I am currently a neonatal ICU nurse. So I do work with small babies that are either premature or just need an extra time in the emergency room just to develop and grow before we let them go. But I do also work as a COVID response nurse per diem. And so what that means is that 2 to 3 times a month, I am at any point in Rhode Island where I live, and I'm swabbing residents to see if they are positive or negative for COVID. So that is my current direct line to the pandemic. However, when the pandemic first came about last year, I was working on a unit, not the current one that I'm on, where it was transferred into a COVID unit. So day in and day out, I was working with COVID patients as well as our oncology patients. That's what we were servicing at the time. So I did have the direct line of patient care when it comes to pandemic experiences. And as you can imagine, that was very scary, nerve-wracking, challenging, just like all the emotions you could possibly feel, especially as a healthcare provider. I do believe I was one of the first nurses in the whole hospital to care for a COVID patient. Because I work at a maternity hospital for the state, we aren't seeing as high numbers as general hospitals that have an emergency room and ICU. We are seeing women come in and pregnant women or babies. And so that just because of that specialty, we're seeing a lot less numbers. However, we did see them. So that's why I believe I was one of the first nurses in the entire hospital to work with a COVID patient, because on our unit, that's where they were coming to. And I know that, I was the first staff member that I was working with to care for COVID. So yeah, I mean, there's obviously been a massive impact that the entire world has had with this disease. I'll say from personal experience, I do think that it's starting to go in a positive direction. I have myself received both vaccines, as well as many of the colleagues that I worked with. I'm pretty sure we were vaccinating around like 1,000 people a week, something like that, crazy numbers. So the response is very welcoming in terms of healthcare to vaccine. But I do obviously I do worry about the public distribution. We're still rolling that out. It's been a very slow process. I think in my state, we currently just got to the phase where adults 75 and older are being able to get the vaccine. But I do still worry about, Black and brown communities. And I myself live in a highly Hispanic community. And I know that the response just from my own family and from where I'm living is not great when it comes to the vaccine. I think there's a lot of mistrust when it comes to information that's been allotted, and that's a problem. So I am trying to wrap my head around like some encouraging words to leave with. But I think like in terms of like the Segal Network, and all of our goals are to be leaders and to leave the world better than we left it. And I think like in my lens, not only do I want to do that as a nurse every day in what I do, but also just in my everyday life as Raquel. So I've tried to be part of as many conversations as possible, especially when it comes to having conversations with minority communities, because like I said, I think that's a really, it's a prevalent, I don't want to say issue, because I don't think we've gotten to that point yet in determining whether it is or isn't, since the distribution publicly isn't where it needs to be. But I do worry that it won't be up to par just based off of the disinformation that I've seen from just the pandemic in general, and having folks go out and get swabs. That was like the first challenge, was wanting people or motivating people to want to just be tested. And for a while that wasn't happening. And so now, because we've been in this pandemic for a year, we're seeing that it is happening. And now the next challenge is to get people vaccinated. So yeah, I'll end there just so that I'm not taking up too much time for everybody else to speak. But I will say where we started and to where we are now is much improved. And I no longer fear going to work. I was for a while very worried about the way that I would be impacted if I was going to impact any of my family members just by my job. And that is no longer a worry. And so now my focus is on getting the correct information to the people that need it. And I'll end there.
Thank you so much, Raquel, for all that you're doing and also what you shared today. And I think we were still having cohort meetings regularly with our national service cohort. I think the week that you had your first COVID patient and you shared
Yes.
that. So we appreciate that you're helping us understand your experiences and that you're doing so much. And Imani, will go to you next.
Hi guys. So for me and being on the front line of doing COVID, it started after graduating in May 2020 of just in that rut of just the start of the pandemic, looking for a job, recent graduate and things like that. And for me personally, I know I've always wanted to help people. And as time progressed in my Brandeis career, health, mental health, any health aspect was very important to me of how I wanted to help. So I started at Devoted Health, which for me started virtually because I was a member service guide and I was more in the demographic of working with elderly folk with Medicare and kind of helping them through the process with their benefits and things like that, but also in a way helping them navigate in a way through COVID over the phone. So it was a very interesting role for me of just kind of being a support system for them, just because I throughout the day did talk to various elderly folk, various groups, backgrounds of that sort, and just kind of helping them understand if they're now recently getting into Medicare or transferring over to Devoted Health, how it would work for them, and also just kind of in the best way possible, giving them the space to vent about COVID and how, whether it has affected them or affected their family and things like that, of how I started my work in the healthcare field recently. And then just kind of took a break of just a little bit of feeling overwhelmed, but also just figuring out what I wanted to do as well, just because I recently had graduated and ended up applying to CityMD Urgent Care in New York City, where I currently live, and went through the whole orientation process and now more so in the front line of dealing with COVID as being a patient care representative. So kind of just creating this atmosphere as welcoming as possible for patients to get tested, as well if people do come out positive, and depending on the severity of making calls to assisted living to get them over to an emergency room, as well as kind of just dealing with sending out lab reports, getting referrals for patients and all that sort, where transitioning from having started being in the pandemic at home to now working where I'm mostly in the space of where somebody will probably test positive or not, and kind of just as well as being urgent care, definitely moving fast to make sure enough people get tested. As well for us at CityMD, some CityMD sites do have the vaccine. So we've been able to give a good amount of people in New York the vaccine. I personally haven't taken it as well, and I've just experienced having COVID. So it's definitely put a lot in perspective for me, as well as my family, of being the only one in the healthcare line. But I will say, agree with Raquel of how the pandemic started and where it's going has definitely improved with the help of the vaccine, but also people just generally being more aware and taking the precautions, and just kind of every day of just feeling like grateful and happy that I'm able to help in the way that I would like to help, and continuing this healthcare journey of being on the front line with this pandemic. So yeah. That's all I have to say for now.
We're grateful for you, Imani, for all the different ways you've had an impact, and what you share, that throughout the different roles you've had, you're always being welcoming and a focus on your patients and your family's mental health as well as their overall health. We're so lucky that they're coming across you as they navigate this, and we hope you stay safe and well. Thank you, Imani. Now we're going to move on to hearing from Freedman Consulting, Tom Freedman and Maria White, about their work. And Tom and Maria, I know you guys were going to figure out how to divide the time, so I'll turn it over to whichever of you wants to kick us off.
we've choreographed ourselves well, I hope. So I just want to say thank you again for having us, and it's really wonderful, especially looking forward to hearing from the fellows about what they're thinking about and interested in. The way Maria and I thought we'd divide up the time is I'd say a little bit about the origin of the firm and the areas we're working in, and Maria's going to dig in on some of the specific COVID-related things, and I'll close by pulling back the lens a little bit on a couple of the lessons I think we're seeing. But the basic notion of the firm, as I said, is like, how can we improve the world? And for myself and Maria and other people at the firm, often, like I started working in refugee camps in Africa and said, oh, I better learn about politics and work on Capitol Hill or in government and go to law school. I think for a lot of us, it's kind of a searching thing of how do you be impactful? And COVID in particular is an example where it cut across all the different types of work we're doing, and we better become experts in some areas of it as quickly as we can. And I'd say the big buckets of our work are collaborations where large foundations, for instance, on criminal justice reform or other, will be meeting together and trying to think, is there a joint strategy? Then individuals where there'll be either individual nonprofits or funders trying to think how can they be maximally effective, and a fair amount of public policy orientation to it. We're based mostly in Washington, but all over, and Maria's in New York, where you think, especially like public-private partnerships or other work that can be created. I'm particularly proud of one that I think Maria will mention, where with like the state of California, in the last year, we helped create 27 public-private partnerships. They raised over $3.9 billion. And a lot of them are COVID related. So a lot of very quick response, especially trying to think about communities in need. And I think I'll turn it over to Maria to try to dig in on some of this and also give her really interesting background.
Thank you so much, Tom. And I will also just take a moment to thank Imani and Raquel for their work, because I'm here in New York, where CityMD is a huge lifeline, and my family is in Rhode Island. So thank you so much for everything that you're giving to the community. I think something that's really fascinating that we're seeing in our work is that, and I think people know this, but just to articulate it, is that the crisis has shone a light, importantly, on the underlying system-wide challenges to the delivery of services and the equitable access to resources that communities face, and has exacerbated that to the level that people are realizing we have to prioritize this in a really huge way and right now. And so some of the things that we're specifically working on that kind of touch that and that really go at that. And I think some of the good news is that we were already kind of working on a lot of these areas, but now this has sort of shifted the focus to be, one, super duper accelerated, and then two, deeply focused on the sort of new types of challenges that occur in delivering those services and in trying to ameliorate a lot of the inequities in the sort of crucible of a global pandemic. So one of the things that's really been important is shining a light on the stories of those who have less access, especially due to poverty. And so one of our colleagues, Bill Nichols, has created an effort to lift up the stories of those who are living in poverty, and has an amazing nonprofit poverty journalism project that he's been engaging in, which I think is super duper important in lifting up the stories of those who are most deeply impacted and least able to access the resources that they need, whether that be housing assistance, or whether that be the kinds of technology that are required to attend work, or child care, or long-term care for their elderly loved ones. Another really important thing that sort of Tom mentioned, and that I kind of want to lift up in a larger way, is sort of the way that philanthropy can plug in with government to help to deliver resources, and how philanthropy and government can connect with civil society in a way that thinks deeply about place and thinks deeply about how people access benefits and helps them to do that in more concentrated ways. And I think some of that work means that philanthropy has started to understand that they need to get a deeper sense of place, that they need to get a deeper sense of the unique challenges in locations. And I think one of the reasons why that has become so obvious and so important during the COVID-19 crisis is because of the real challenges that people are having with paying rent and the need to get rental assistance and housing assistance to people directly. So I think a lot of what we're hearing from our partners, from our clients, and from some of the organizations that we work with regularly is that there's a lot of thinking and attention being paid to how do we partner directly with local agencies to get help to people in that way. Another really interesting and important and I think helpful project that we're working on is helping funders who resource criminal justice reform efforts and efforts to end mass incarceration on how to support organizations better. And I think this has become wildly important as we face the COVID-19 crisis because of the vulnerability of populations living in congregate settings, of which prisons are an incredibly dangerous one when it comes to the transmission of infectious disease. And so helping them to think through how to do that advocacy and what kind of policies to lift up has been very important, again, often because of the hyperlocal nature of the issue. And so in the longer term, we're thinking really broadly about how to make sure that equitable access and the nuances of the types of populations who face barriers to their ability to access services and benefits is a lens that we sort of have ramped up, that we've always had, but that we're really ramping up now, and that we're excited that we have more of an audience for now, right? I think everyone at our firm has always understood that as you're looking at these policy areas that we investigate and that we advise on, that the lack of equitable access and the historic underpinnings of that are always the most sort of accurate backdrop and lens for what we want to improve and how we want to have impact. But now we really have the ability to be heard on that in a way that I think is really exciting and not completely new, but new in some instances. And so we're doing everything that we can to sort of amplify that. And I think one of the areas that is sort of most obvious that we are excited to see energy around is the social determinants of health. And we sort of feel and have noted and have understood in our own research that quite a bit has been done to research social determinants of health, particularly regarding racial inequity, but that really there is a lack of research around intervention. And so new energy is going into how do we intervene to improve the disparate impacts on health that people see across different vulnerable communities. And so we're really excited to be a part of these efforts and to advise not just philanthropy, but organizations carrying out the work, how they can work together, because it really is obviously an all hands on deck moment for philanthropy, for civil society, and for government. And so we're really thinking about how we bring those lenses all together to deliver as much as we can as we try to recover and try to do so in an inclusive and forward-looking manner that starts to build something that is a much better approach to democracy and to the delivery of not just benefits, but access to communities. So thanks so much. Looking forward to talking with you more, and I'm going to turn it back over to Tom.
Right, thank you. And I'll just be 1 minute. I realized when you thanked for the work in Rhode Island, I should thank Dr. Mendelsohn, because I was probably a pediatric patient of hers. I grew up around the University of Chicago and have 4 siblings. So thank you for that. And I would say that just looking forward, I do feel like it's revealed what lots of us knew, but in very stark and terrible light, the inequality and the challenge of vaccine hesitancy and other things. There's a policy matter, and I think we're going to see the global challenge that we're shortly hopefully going to be flooded with vaccine in this country, and there are going to be parts of the world that aren't. And how do you A, reconcile that that's the world we live in, and B, try as quickly as possible do something about that, I think will be important for our work.
Thank you so much, Tom. Thank you so much, Maria. It's amazing to hear the breadth of the partners and clients and organizations and governments you're working with. And I appreciate you tying it into those larger underlying issues. Now we're going to hear a little bit of a different perspective on how the Innovation 80 has been tackling not only their mission with small arts organizations, but also how they see it as a COVID response. And when Carol, Arnie, and I spoke last fall, I was so interested to hear about Innovation 80 as a whole, and then so glad to have my mind broadened about how something like this could be a response to COVID. And so Janice, I believe you're going to start us off, and thank you for sharing.
Thank you very much. I'm pleased to present a different perspective, but one that is equally important, I think. And I would refer everyone to our website, which is innovation80.org, to fill in details which I may have left out because time is an issue. But I wanted to start with our original mission statement. We're a series of 3 founders who were sitting around one day trying to figure out what more we could do for our lives as the coronavirus was taking over our lives. And our original statement, as we launched Innovation 80 a year ago this past February, it's only been a year, and we wanted to use the arts to support underserved communities in the Chicago area, in particular, the South and the West sides. And as we were approaching 80 years of life, which was the reason for the 80 and the reason for the innovation, we were looking for something more in our lives rather than just satisfying ourselves and doing a lot of traveling and whatnot. And after setting these initial goals, then shortly thereafter, surviving the pandemic became our mission. As the COVID virus grew to outrageous proportions, interfering with our goals, not only our goals, but interfering with the organizations that we wanted to support, with their ability to support their clients. And the clients ranged from kids in an after-school program or within school, partly homework program, and adults. So the struggles of these small arts organizations were huge, and these struggles compelled them in the face of the epidemic to adapt to new ways of doing things. So it was no more FaceTime, it was no more hands-on. It was experiences that was the bulk of what they did. So they had to find innovative ways to recreate their programs, but not all of them were able to use easily or adapt easily to the virtual stage. And the struggles of these small arts organizations compelled them to figure it out, and especially compelled them to satisfy their participants in ways that they had not considered before. For they didn't know how long this would last. We didn't know how long this would last. So we had to adapt as well. And adapt we did. And it's now been more than a year. And so as we celebrated our first anniversary, we found an amazing, amazing, amazing amount of resilience and determination among these organizations to provide the kind of exposure to their participants that was lacking given the pandemic. And what we did was try to help them with that. Not all of them could move quickly, but some of them were better than others. Some of them were limited by structure. Some of them were limited by expenses. And some of them were just limited. And these were huge challenges. And so we decided to look for innovative ways to help these organizations adapt to face their struggles to survive. And for these small arts organizations, particularly on the south and west sides of Chicago, the struggles were huge. They were amazing. And they were, though, committed to maintain their commitment to the kids and adults that they had chosen to serve. So this was our issue. And before we could move forward too quickly, we decided we had to do something different. And it was more than just cleaning up the beach, as Arnie pointed out to me one day. It was arranging for us as well to change our way of approaching these organizations so we could help them better. And so that's what we did. We expanded our planned giving. We added more organizations to our list for this year. We acted as a catalyst to put organizations together, whether they were similar or not so similar, in ways that would enhance what they could do together. We added for us and for them a group of advisors who were younger than we are, and we hope will then continue beyond the 5 years we're committed to. And consultants whose expertise provides information for us on the philanthropy level, on the legal level, on any level that they would find helpful to us. And so we've got an amazing organization now behind us. And we also found donor partners who would help increase the funds that we had available to give. So we are giving more. We are being partners with our grantees, and you should really check out the website to see the kinds of organizations that we've provided funds for, who are not just our grantees, but who are our partners. So in particular, the first 4 that we funded are part of the organization in a way that helps us understand and helps us get more organizations that we can fund that are within our boundaries. And it's been wonderful. They're like our children. Now, it's kind of funny to put it that way, but that's who they are. And the same goes for those that we are funding. We've just completed our list for this year, and they're now 8 instead of just 4. So we found ways to maximize their benefits from us, and we've found ways to maximize our benefits from them. And I think that it's really been an incredible experience. Most importantly, I think, having just celebrated our first anniversary, and of course we couldn't have a champagne fest, that's too bad, but most importantly for us, and who would have known, we want to continue the fun of doing this. I mean, that's part of it, that it's been a great experience. It's been an amazing learning experience. We've learned to work together, which wasn't always easy in the beginning, but we've learned to work together. We've shared our backgrounds to bring together a cohesive unit and in providing these funds that we have committed. And I think who would have known? So together, these joys and the fun has stoked our enthusiasm for continuing to provide care. So even as a previous healthcare worker who can no longer participate, I gave up my license, so I can no longer participate in healthcare activities, I can participate in this, and I'm having a great time. So I wanted to leave a few minutes if Arnie or Carol wanted to contribute any comments, that would be fine. I think there are a few more minutes that I've left, but I again suggest that people go to the website. It's not only the best website in the world, it's really very, very informative.
So I just like to say that it's been important for us to get across the message that as much as we need people like nurses and vaccines and all the things that are going to make people physically get through this in a safe and healthy way, it's the arts that are going to also contribute to their mental health and their souls, because that's what we're about. We want to make the life that they're going to go toward worth living. And I mean, obviously, employment and jobs and all that stuff is key, but also in terms of feeling the best, experiencing the best of life that arts can provide is really important to us. And I think to the, certainly to the organizations who are engaging these people in ways that are important and meaningful for them, and also to the participants themselves.
Yes.
Thank you so much, Carol. And just making sure, Arnie, you look like you're letting
The ladies go.
He's muted. Let me see if I can unmute.
Going to yield the rest of the 3 hours that were allocated to me.
Okay. Thank you, Arnie. And I want to thank all of you guys. I know we put into the chat the general website. I'm also pasting in the link specifically to the mission, because the language there about seeing this as and seeing supporting arts organizations in the communities they serve as a really crucial thing, not just to getting through, but preparing for beyond COVID, is powerfully written there. So with that, we're going to move to discussion in a second, but I know, Phyllis, you said you might share for one more minute about the project you're involved in that you referenced earlier.
Yeah, thanks, Susie. Thanks, everybody. This has been extraordinarily interesting. It exposes the panorama of problems created, some created, some exacerbated by the virus we are living through, and also the different ways that that each of us can be engaged in making a difference, from large-scale policy and billions of billions of dollars going into public-private partnerships, to working on the front lines. Raquel and Imani, it's amazing to me what you're doing. I remember, Raquel, our first conversation when we talked about it. And the very localized focus of individual philanthropy in their community, in an area that we don't often think of as frontline important, but clearly, as Carol just said, the arts is crucial, and small local organizations are crucial to our survival. I just want to mention, and it goes back to Raquel's opening, that as an illustration of another way that, yet one more way that citizen leaders can jump in and make a difference. I saw an opportunity the end of December as the need to get vaccinations into people's arms I was first becoming aware of the gap and the lack of planning for that. And a combination of my knowledge of national service and involvement in national service, and work that a colleague has been doing in California, bringing retired physicians into federally qualified health centers, saw an opportunity to close this very specific to the pandemic gap and need around vaccinating underserved communities. And it started with an idea that my colleague and I wrote about, got published, the Biden administration read about, they liked it. We are now in the process both of standing up an intergenerational COVID vaccine corps in 8 Bay Area federally qualified health clinics, and offering the idea and tools to make it real, including funding that we have identified through National Service to other health centers around the country. Everything I've ever gotten involved in working on social problems has given me an opportunity to learn as well as to contribute. I'd never heard of federally qualified health clinics before this. I'm hearing through all of the presenters the ways in which what we do also introduces us to what we don't know and expands our knowledge of how we can address social problems. So I just wanted to make you all aware of this. And it's just another example of how you can take an idea, jump in, and my colleagues call me a bulldog on how I'm making this work.
Thank you so much, Phyllis. Such a powerful and important example. Appreciate everyone we've heard from, and just want to take a second. Maybe what we can do given the time is we'll just collect some questions or comments and then leave each panelist, a time to see which one they want to respond to in closing. So any comments or questions? And again, we won't answer right away. We'll collect them all and then go back to the panelists.
So I'm curious from Raquel to understand how the patients and the patients' families, the infants' families, are coping at this time with fears of the virus all around them.
Thank you, Phyllis. Any other questions for Raquel or Imani on the health side before they answer so that they can answer together? All right, then we'll turn it over to that response.
I would say generally the families have been very open and welcoming to the restrictions. So in the NICU, currently we only allow 2 support people, which usually are the parents of the baby. Sometimes it'll be a parent and a grandmother, say. Before the pandemic, any family member was allowed to come to the NICU. Because it's an ICU, there were still standard precautions and restrictions just in terms of, cleanliness. But I think I would say in my experience, the response has been very good given the circumstances of not being able to have everybody come visit the babies. And I do think too, I noticed that when I transferred from the unit I was prior to the NICU now, my exposure to COVID is a lot less. The chances of having a baby have COVID are much slimmer, just given the fact of the population that I work with, and families don't come in if they're sick. So I'm seeing a lot less of impact than I was on my prior floor. So I'll give kind of like a little bit of background on that floor. There was a lot more conflict when it came to talking to families and trying to have them understand the situation and have them recognize, like not everybody could come visit your family member. And that was really hard. And I was working on an oncology floor, an oncology med surg floor. So we did have patients that were on hospice or end of life, as well as patients that had COVID. It was a really strange mix of different spectrums. So those moments were hard because, like I said, we would have to talk to families who, if they did have a member that was on hospice and towards the end of their life, where they would want everybody to come visit, which is totally understandable. However, we did have to face the fact that we had certain policies in place. So that experience was much different from what I'm now seeing in the NICU. And I'm not quite sure how much it has changed on that floor, but I suspect since it's been like over a year with this pandemic, that there's been a lot more understanding. But to my knowledge, there also has been a lift of restrictions as well. So I'm pretty sure that there's more opportunity for visitors to come in, and rather than just have 2 support people in other floors on different units in our hospital, there's you can have more. So I think that's a good thing.
Thank you, Raquel, for sharing a bit more about that. I'm conscious that we only have about 2 formal minutes left, but some of our panelists said they could stick around for a few minutes afterwards. So after we close at 2, we'll just keep the line open if people want to stay on and talk a little bit more. But I hope that this has given everyone, it's certainly given me the chance to think about, sort of as Phyllis said, that breadth of how people are responding. And the Segal program has been designed since the beginning to help us think about connections across the network. So hopefully some emails or some phone calls are going to be happening after today because somebody said something that inspired you and you wanted to learn more about it. But just also briefly wanted to say, leave it open if any of our panelists wanted to leave a charge or a phrase with the group before we go. We welcome that from our panelists.
I'll also agree with Phyllis. It's inspiring to hear the range of things people are thinking about, and I may have to drop off at 2, but I'm also open if people want to email us questions or ways we can be helpful. I know Maria and I would be happy to.
Thank you so much.
Yeah, I want to echo that and share my gratitude and how inspired I am by everything that everyone's doing. So thank you so much for having me with you today and letting me listen in to your work.
Thank you.
I'd like to just underscore Janice's plea to look at our website, because under the grantees part, you will see 12 organizations that are incredible. And the people who lead them are filled with passion and dedication and creativity. And I couldn't be more excited about this group of grantees. And if you have any questions, you're free to email any one of us and we'd be delighted to talk or email or whatever.
Imani or Raquel?
Thank you everybody for taking the time to listen to all of the panelists. I think it's really important to not only like hear perspective of people on the front lines, but just people that are impacted in general by the pandemic. So these conversations are always great and I love being part of them. So thank you.
Yes, just want to echo that and just excited as well of seeing how arts definitely plays a role, because arts and like just health in general is what I'm very passionate about. So just having this conversation was just really nice and great.
And thank you.
Well, everyone for joining us, panelists and listeners, thank you for being a part of the Segal Network, for all that you do and for all the ways that you're responding to the COVID pandemic. I'll stop the recording now. Big thank you to everybody and our panelists especially. And if anybody would like to stay on the